Good afternoon, everyone. My name is Angela Brand. Pronouns are she, her. I am with the CARE TA Center. I will be your moderator and facilitator for this session. This is maximizing social determinants of health, equity, racial, and social justice. So I'm really excited to introduce our presenters today. Ebony Chambers-McClinton and Tamisha Wallace are both with Stanford Sierra Youth and Families. They will be talking through our panel with us today. And so I'm going to turn it over to them to introduce themselves to you.
Yes, hi everyone. It would be really great to see who's here. So I'm looking forward to what shows up in the chat and so grateful to be able to share space with you all today. I know they mentioned this morning just how many folks are managing and navigating burnout and through their day today, how difficult it is to be present. And so we just appreciate that you're present with us today and sharing space to have this dialogue around equity and maximizing youth and family voice and uplifting community in all the things that we do. And so we're grateful you're here. As Angela shared, my name is Ebony Chambers-McClinton. I am Chief Family Partnership Officer at Stanford Sierra Youth and Families. Is a mouthful. I am also a mother. I am a daughter, a sister, a partner, a healer, a peer with lived experience, and a very much so passionate about equity in our systems of care and ensuring that in all that we do, youth and family voice, individuals with lived experience that are navigating the system, that things are not happening to them, but with them and in partnership, and that they are leading their service delivery. And so we'll be talking a bit about what that looks like out of the lens of equity today, and looking forward to that discussion. Any questions you have as we're discussing that we can clarify in the moment, please feel free to unmute yourself or use the chat. We are really hopeful that this is a dialogue. We grow through discussion, so don't hesitate to jump in with us as we answer these questions and share your insights.
That is a huge intro to follow. My name is Tamisha Wallace. I'm the Youth Advocate Manager. I work alongside Ebony at Stanford Sierra Youth and Families. As she mentioned, this work is very near and dear to our heart. At the agency, I serve on our Cultural Competency Committee, as well as a cultural broker supporting youth and families, as well as the Youth Advocate team. So excited for the conversation today.
Thank you both. We'll move to the next slide, which I think is just our learning objectives. So real life examples of how communities empower and engage youth to focus on equity and social justice, to explore the interconnectedness of substance use and social determinants of health, and to identify opportunities to integrate health, equity, racial, and social justice approaches into prevention services. And so with that, we'll go to the first slide, with our questions. And we'll start here with, please describe how your agency supports children, youth, and young adults experiencing behavioral health crisis.
Tamisha, you want me to take the first one?
I do not mind jumping in. Something I definitely want to preface this conversation with is that I am huge about prevention, especially when we're talking about health disparities and equity. And something that I think our agency does a great job with is at intake, making sure we're asking very intentional and relevant questions about who the families are, so that we are creating safety plans for youth that are very individualized. So as crises occur, our team members are able to reference those safety plans when they're going out to support in the moment, so that they're not having to ask families in the heat of a moment while they're in the midst of a crisis, how they need to be supported, who's their necessary contact people and natural support team around them. And as I mentioned, it's not a cookie cutter approach. We're asking questions that are very relevant to that youth based on previous crisis experiences, based on their specific diagnosis and so forth. So for me, I love that intentional just prevention plan, as well as the teaming that goes along with that. Although the clinician or the facilitator may complete that intake, there also may be a social worker or a peer mentor, youth advocate, or a family partner on the team who may also have access to that safety plan and are able to utilize that if they're going out to support. When I say go out, our agency is a community-based agency. So we're going out in the moment, in the midst of crisis, to support youth and families in the moment. If it is after hours, we do have a on-call system where we also have team members who are available and ready to go out and support as well, who also have access to those safety plans. So I think the teaming aspect of sharing that very relevant information from the start of services is very helpful in prevention and also in the moment and supporting with those crisis situations. Ebony, I don't know if you have anything you want to add to that.
Yeah, I just going to take a step back and share just a bit about Stanford Sierra Youth and Families and the work that we do providing youth and services to the greater Northern California community. So in a variety of different ways we have a wraparound program, outpatient mental health that's really community-based, and juvenile justice intervention services, a pathways program that's directly connected to our youth that are in foster care, and just a number of other, a CSEC program that works with youth who have been at risk of being sexually exploited, and then our family and youth partnership program that has a real focus on peer-delivered services and supports for both the parents and for the youth. And so as we think about crisis, wholeheartedly agree with Tamisha on that important aspect of prevention and having those early interventions in place before crisis occur, but also that as families are engaging into services initially, that those conversations are happening at the very beginning. So as Tamisha shared, the safety planning is happening proactively, as well as the match with a peer support as a part of their journey. So youth are matched with a youth advocate, and parents are matched with a parent partner that all have lived experience and can support with that navigation, in addition to other team members, clinicians, social workers, and any other levels of support, skills trainers and facilitators that can all be a part of that team to support family. And so when we think about that behavioral health crisis and really looking at equity within that, we know that we alone are not here to do that work, that it really does require community, that we have to connect our families in the community, because those are the folks that are going to be there long after we're supporting. So we're looking at a few areas when we're thinking about families and youth and young adults experiencing behavioral health crisis, and that's their natural support systems, the community resources that are available to them, how well they can manage and navigate plans. And so we utilize a tool called the Transition Readiness Scale, our advocacy team does, that really kind of explores some of the areas that helps them to consider the many areas that they can grow or strengthen towards managing their own crisis as well. And I think that's something that's been really helpful, in addition to having someone that's walking alongside them that can help to elevate their voice and really bridge at times the engagement that's needed to be honest about what's happening with you, because families all define crisis in many different ways. And so that's very personal and individualized, I think, as Tamisha shared. And so, by really understanding some of those basic needs, it's important for us to know that, so that we can help them to navigate some of the crisis situations that may come up for them. Some of that is housing, food insecurities, racism in the community, and some of the larger community impacts also can bring about crisis in families' lives. And so I think it's important for us to name some of those things when we're first interacting with families, interacting with young people, to support them in identifying some of the things that they might not even be thinking of that has them activated and triggered when thinking about crisis.
So much to think about, but really resonating, like the definition of like what is a crisis, and really thinking about how folks are coming into that situation with very different contextual experiences, and keeping that as the framework that's really resonating. And just wanting to share, like, folks are really excited to be in this space with you both today, and so just thinking about some of the happiness that was shared there. And so we'll move to the next question. You've talked a little bit about how you're doing this, but how your agency is supporting resource parents and other family members when children, youth, and or young adults in foster care systems are experiencing behavioral health crisis.
So I started answering that question in the first question, Angela. I talked about some of those layered supports through our family and youth partnership team. I didn't mention our housing navigators as well. One of the things we found, again, when it comes to having those additional layers of peer support and housing navigating support, is that oftentimes when families are first coming in, there's a real lack of trust. And that's something that, especially for communities of color, especially for even those intersections of identity, our LGBTQ community, when they've experienced bias, discrimination, and racism when trying to access care, that there is oftentimes hesitancy in how much information that they're actually sharing with new providers when they're first starting. And so we can't really get to addressing that crisis. And that's where the peer supports that can relate and share maybe even some similar experiences that they've had to navigate are really supportive in breaking down some of those barriers. And so I would say that's one of the amazing supports that we have, in addition to, having financial resources as well to address some of those things. So we have funding to address some of the housing crisis, and we have Lifeline, what we call Lifeline supports, which is a pool of funding to address some of those emergency needs that impact youth and families and can potentially help to mitigate some of those crisis situations as they come up for us.
I love that you all talked about like what is considered a crisis, because I think something that Family Youth Partnership does is we uphold family voice and choice. And I think about serving certain communities or certain youth, especially youth who are at risk of sexual exploitation. A family or the team could feel like the crisis is the youth running away or the youth using substances. And as Ebony mentioned, for that youth, it could be they need a stable place to live, or they need food, or they need to get their basic needs met. So I think when we slow down and empower the family to tell us what their current crisis is, as opposed to us defining that and establishing how we're going to serve them, is something I think is very necessary to make sure that we're meeting those priority needs and that families can develop that trust and lean into services because it's guided by their voice and what they feel is necessary in the moment. So I think for service providers, I think that's very important for us not to determine what the crisis is, but to allow the family to choose where we need to start with our service provision.
Yeah, I would also add, we have a lot of other layers of support. And every time Tamisha shares and I start thinking about some of those other areas that are really important, we have 11 concurrent support groups that are available to families during the month. And they are culturally specific to families. So we have support groups that support our LGBTQ community, one for fathers, one for Spanish-speaking families. And so I think, having these different areas of support that are also culturally specific, that says we are creating a space where you can connect with others who have similar identities, similar journeys, is also a safe space for others to join in and have that connection. Our youth advocacy team is an amazing group that also facilitates our resilient youth leadership speaks out. So we call it RISO for short. And we also have LIT, which is Leaders in Training. And so those opportunities as well to build capacity so that they may be able to support others as well, but also just have a safe space to land once a month, a couple of times a month in many different ways, both in person and virtual environments also are other layers of support as well that help to manage and mitigate crisis.
We've had the pleasure of working with your team through the Care TA Center, and just, I don't know how in an hour we would even be able to thoroughly talk about all the amazing things that you're doing and the supports that your agency provides. It's just, nothing short of amazing, what you're doing out in the community. And so just excited to really be able to highlight that here. And thinking about that and where you're coming in, recognizing, the unique experiences and perspectives and lived experience that folks have. What recommendations do you have for crisis care workers, those working in mobile crisis units, crisis lines or recovery centers, things that they should consider when engaging with children, youth, or young adults during a behavioral health crisis? It says foster care experience here, but thinking broadly, if there's anything that stands out just in general about that.
I always think of how necessary it is to streamline communication, to really have as much info as possible prior to engaging with the youth or family. As someone with lived experience, is traumatizing one time when you have to share an experience or even reach out for support, as Ebony mentioned, when there's so much lack of trust in the system and asking for help. So I think the more information we know that we can be responsive to, as opposed to putting that responsibility on the youth or family in the moment, to give us a rundown of history of what might be necessary or things to consider. If there's a social worker, if there is a youth advocate, if there's a clinician, if all of these folks have information, if we can streamline that to better figure out our approach, I think is very necessary. As well as just listening. I think the youth will tell you in the moment what they're really needing. Again, as opposed to us jumping in and supporting how we see fit, listening for what a youth has experienced throughout the day, what really set off that crisis situation. Is this something that has been a continued crisis throughout the week or the month? And really learning what those underlying needs are so that we can be responsive to that and empowering them in the moment to know that, again, their voice is really leading that process.
I agree. Tamisha shared it, and everyone's been hearing me say lately, co-production, and that's exactly what Tamisha is speaking to when we're thinking about recommendations for crisis care workers, and what to consider when engaging youth and families and adults, anybody that's engaging in a crisis. We say nothing about us without us for a reason. And that just means that from the beginning of the planning process, if you are developing a mobile crisis unit, crisis lines and recovery centers, that is co-produced with those that are navigating those systems. That is the best way that we're going to see the engagement that we need. And that's going to look differently from community to community. And based on, the demographics of that community, the landscape, urban, suburban, rural communities all have varying needs. And so really holding listening sessions and finding opportunities to engage community. We hold listening sessions, we hold parent and youth panels quarterly to gain feedback on what we're doing. We have a trauma-informed, what we call a trauma-informed follow-up for when families are calling our crisis line. So we have folk, getting feedback on how was that for them and what we can change. And we've made those adjustments within the services that we provide. Initially, we were calling and families were saying, they were initially calling our on-call, and they had to talk with an operator who would then direct them to an on-call support, a clinician. And the families were sharing, this isn't working for me. I have to, there's too many layers to getting a response when I'm in crisis. And so we heard that feedback after having this loop of opportunity to gain that feedback. And that's how that's co-produced. And we made the changes so that those services were better aligned with the family's voice and saying what worked best for them. We were recognizing that after a crisis, there was, there needed to be information, opportunity for families to first have space. So we called them the next day and they're like, I'm exhausted. Call me back in a week. Call me back in a couple of days. And that's critical and valuable information for us to not overwhelm the families more than what they've already experienced when they're just coming out of a crisis. And so we took that into consideration and just found different ways to make sure that we are keeping that loop open for a constant feedback. And so from beginning planning stages through implementation, that voice to the advice or recommendations should come from those that are being served and supported.
turn my microphone back on. Thank you. Yeah, so much to consider there. And a lot of that's just really resonating, thinking about co-produce. I like that. And I think that's a great way to empower those that are involved all the way around to be part of that. I really like that term. Let's go to the next slide. We've got the next set of questions there. So this one here is, what are the greatest barriers to stabilization and recovery during behavioral health crises facing children, youth, and young adults with foster care system experience?
Ebony mentioned that we have hosted multiple listening sessions for youth, and this is one that I really enjoyed youth speaking to, because I was going to say lack of resources, but I don't think it's a lack of resources for stabilizing and supporting youth. It's the lack of access and navigating them. And some of our youth in the TAY population mentioned that there are plethora of resources there. However, there's no direct support with linkage to them, especially if we think about how programs are impacted greatly by the pandemic. And if a youth is in crisis and they're frustrated, they need support. And sometimes, as Ebony said, walking alongside them and navigating that. So I think one, just making sure that they are aware and have proper linkage to those resources for stabilization. I would also say service provider bias is a huge barrier for stabilization and recovery with high needs or high profile cases or youth. We've actually heard some team members and community partners say, or I read this, or this is a high profile case. And I think when we're thinking of terms like that and we're coming in with that perspective, it could be pretty dangerous, because we're automatically assuming maybe who this youth or who this family is and what the experience may be. And again, if folks are already having a lack of trust in service providers in the system, someone's not going to naturally engage with a team member who may be utilizing that type of language or whose energy is presenting in that way. So I think being mindful of the energy you may have when you see a family navigating a crisis, and your bias that you may be bringing into that situation. If this is, I think about some of our youth who are being sexually exploited. They say it's a choice. This youth is continuing to go back to her exploiter when we know that it's not a choice that this youth is engaging in. They're surviving. So if we're going in with that bias of saying, you're choosing to go back, we're not going to be as responsive or as quick with our response with making sure that this youth may have what they need. So I think with stabilizing a youth, it's very important to make sure your bias is in check and you're being mindful of what the youth may truly need in that moment.
I would add, just as, the topic of kind of the discussion around social determinants of health, right? And what are some of those? And Tamisha mentioned access, right? So, access to, food and water, access to appropriate health care, access to social and recreational and community supports, access to appropriate and a healthy education environment, and a healthy neighborhood that's not, say, riddled with community violence, and economic stability, right? Those are all different determinants of health, but are often the barriers that contribute to lack of access for many of those that we serve, especially those that are overrepresented and marginalized in our communities of care, specifically communities of color, Black and Brown, Indigenous, people of color, as well as our LGBTQ community. And so I think, as Tamisha talks about, some of the bias that exists, that is something that we have to be mindful of all of those things as they're coming in to our system, that one, they may have had to navigate through those multiple barriers before coming. And how does that leave them, right? How does that leave their ability to be able to engage and stay engaged? And so it's easy oftentimes when we don't hear back from a family for a week or 2 weeks to send a letter out and say, oh, you haven't been engaging, and we're closing this. And that's the need for us to continue to be even more persistent and find out if some of those determinants of health may be impacting their ability to really engage and be successful when they're trying to navigate crisis and receive the support to have a more balanced well-being and have the stabilization and recovery that they need, that those continue to impact the different, the many different things that they're having to navigate. And so I would say that, as providers, I think it's really important for us to be cognizant of all of those determinants so that we are aware of those adverse experiences. We're aware of what the community might be navigating so that we can fold that in to be more trauma informed in our approach. It's easy to kind of stick with, what's in that treatment plan without identifying all of the other factors that impact that stability. And we all know, right, the Maslow's hierarchy of needs says we can't continue to look at some of the areas around unpacking your feelings when some of those basic things are not being addressed.
I agree, Ebony. I would add one more thing, and that's intentional support to caregivers. As you mentioned, we have the support groups, but I think if the family isn't stabilized or the caregivers aren't stabilized, it's the work and support that we're offering the youth also isn't going to be sustainable. So I think making sure that we're being responsive to the entire family system is very imperative to make sure that youth actually is stabilized in their recovery and support. I would also add our agency has a therapeutic crisis intervention training for our resource parents. I think that is another preventative factor for making sure that those resource parents and caregivers are prepared to support their youth when those crises occur. And I think that is something that should be continuous, making sure that caregivers have all of the knowledge, education, and resources so that they're able to maintain all of that great work once us as service providers are stepping back.
Yeah, I agree. And Allie, I see in the chat you had a question around peer support specialists to support with accessing services and help them to access services. And so, yes, our parent partners and youth advocates provide support with system navigation and linkage. And oftentimes even, a family is navigating mental health services and with us, right? And they lose their Medicaid, they lose their Medi-Cal, and there's a need to relink it. And just a few weeks ago, one of our amazing parent partners was on the phone, right? There's those barriers too of hold times and, you called this department and now you need to call, you called this one. I know you were on lines, you were number 78 in line, and thank you for waiting that whole time, but you actually need to call this call. And this was literally what her experience. But then she stayed on the phone with that grandfather and then, got to the other line and ended up being like 120 and, stayed there with him to make sure that the linkage happened. And those are those barriers where a family who's overwhelmed can easily say, just forget it. Right. And I'll just try to figure this out myself in regards to managing my crisis and my services, and then not engage anymore because they don't have Medi-Cal to continue with the services and supports that we're offering. And so I think that's when that peer support is really critical to helping bridge some of that, and also go back to our systems of care and say, here's where we're getting it wrong. These long hold times are a barrier to some of our most vulnerable communities, and something has to change. And just last month at one of our provider meetings, it was elevated, right? That they were aware of the hold times, they were trying to remedy it. But even with that, we can also proactively to discuss that with families. Make sure you're getting your paperwork in on time so that you don't lose some of the benefits, and because calling back and trying to get them re-engaged is really long wait times and hold. So how can we support you in those areas as well?
Yeah, I really just want to elevate all these points you're making about the complexity of access and really what that means, and not just access to the appointment, but access in so many other ways that, just basic need and where folks are coming from, and do they have access to all the things that they need to feel and be whole in that moment. But the other thing that you shared, Tamisha, about just the wrapping around that support for the whole team that's in place to support that young person. And there's so many nuances with that. And so really just wanting to elevate those really strong points that you're making. And thinking about that, kind of leading into the next question, describing the strengths, resources, and resiliencies that you're seeing among children, youth, and young adults that are impacted by foster care systems prior to, during, and after behavioral health crises.
I would say lately, I really want to speak to families' willingness to re-engage. I think as we consider the great resignation or the turnover and burnout that we're experiencing right now in our field, as I mentioned, it's difficult and it's traumatizing to constantly have to readjust to new team members, to retell your story and let folks know what you need. Our families have a huge resiliency factor for continuing to voice what they need and to get their needs met. So I would say they're very resourceful. They're going to figure out how to get their needs met with or without us at times. And I think that is a huge strength to be able to vocalize what might be necessary in the moment. And the willingness to utilize their voice and share their story. I think as peer mentors, we greatly appreciate that because it's informing the work that we're doing and how we're moving forward. Ebony mentioned the listening sessions and the panels. A lot of those are youth and families who've navigated a crisis situation. They're coming back to share their stories so that we can utilize those examples in how we're informing our practices and policies and procedures moving forward. So I would just say their willingness to share to improve our system is a huge resiliency factor and strength.
Yeah, I would add to that and agree. I think all of our communities, when doing an inventory, carry a lot of rich resources, whether that's whether it's community centers, spiritual communities, within their own family units. There's a lot to uncover in the strengths and resiliencies that our youth and families hold. And I think that, as providers, it's a part of our role to help uncover that with them and elevate that with them and for them, because I can share from my own, lived experience when we were first starting to navigate systems with my own family. We didn't feel that we had any, strength. So we were feeling really defeated. We were feeling really overwhelmed. And so it was hard to kind of see any light in our situations. And so it was so great to have, a team of support that uncovered and helped, me to see some of the things that I had been doing really well. The consistency that I had with my family, or, the level of engagement that I had in their education, or, and so oftentimes those, the challenges is what's elevated, right? Even navigating in such a problem-focused society where we hone in very quickly on what's wrong with you, what's going on, what are the challenges versus, what happened well today with you? What ways did you experience joy over this last week? How did you care for yourself or how have you been caring for yourself when you've been navigating these things? How does family show up for you? And so really taking time to ask some of those exploratory questions to sleuth our way into the many strengths that are already there and have oftentimes been there for generations. I'd be remiss not to acknowledge again, our communities of color have faced many atrocities over these years. And we are still here. And a lot of us are thriving because some of those rich strengths and resiliencies that we hold. And so it's important for those to be acknowledged, and not in a way that dismisses their current challenges, but in a way that reminds them of who they are and affirms their amazing strengths and resiliencies.
Yeah, I'm thinking about appreciation for how to reframe and refocus the conversation to affirm those experiences, even when the conversation might be rooted in negativity, or, like you're saying, honing in on that, that challenge or that barrier. And, really thinking about something else that you shared about the defeat that folks can feel, being overwhelmed by the system. But then also in the beauty of those that come through on the other side and come back to continue to share their story and continue to, work in support of others. And what an amazingly strong community that is formed out of that. And I apologize, my dog is in the background. He feels very strongly about this too. But just the strength that is inherent in that, but really wanting to recognize that it did come out of a lot of really painful experiences and a lot of history that isn't favorable and has caused a lot of harm, but to really still find beauty and folks still showing up to support one another and affirming that space. And so just thankful for the share in that. Which leads a little bit into this next question, but thinking about how race and ethnicity, LGBTQ plus identity, and other demographics impacting the experiences of children, youth, and young adults with foster care experience during a behavioral health crisis, and your thoughts on that.
Go ahead, Ebony. I see you unmuted.
Me and Tommy are playing double dutch right now. We're like, you go, you. All right, I'll jump in. Yeah, there's a lot there, and I think this is probably a whole day. This is a whole day here, right? Around, some of those impacts based on identity and how one navigates through various systems of care. I was grateful to be able to be a part of a dialogue on Monday evening with Resma Minikin. He wrote the book, My Grandmother's Hands, which talks about racialized trauma in our bodies and how it shows up and how to navigate that. And I was just so grateful to be a part of those discussions and be affirmed, right, that, very clear statements that the white Caucasian community has a very distinct advantage. We often call it privilege, but he named it as a very distinct advantage in the ways that they can navigate our systems, in all of the ways they can navigate the systems, and how white supremacy culture continues to be upheld in all of our structures and design. And so when we think about the everyday experiences of people of color and those within various intersectional identities of that, navigating behavioral health crisis, it is compounded by the distinct disadvantage that we have. And so I think we have to be comfortable or uncomfortable naming that. We have to acknowledge that that is a reality for those that we serve and those that are often overrepresented. And so I think the more that we are naming it, I see Lizette put in the chat, right? Transparency, accountability, honesty, affirmation, and humility. Those are powerful words, Lizette. And thank you for sharing those, because that's where we start to grow, is through that accountability, through that transparency, by naming some of the system inequities that continue to persist in our communities today. And so ways that it impacts our youth and families, as Tamisha shared before, the access, not having enough clinicians and peer supports, fill in the blank of anyone who's serving our community, communities of color, making sure that we have a reflection. Not having the pipeline there to ensure that our workforce matches our community so that they have more culturally responsive community supports. We've identified cultural brokers in our organization. And one of the reasons why we wanted to do that is because we recognize that our communities hold distinct memory of our community, knowledge of our community, resources in our community, and those that knowledge and those resources and those memories help to bridge to communities that have experienced years of harm. And so it's important for us to have identified community members that are not just identified, but also compensated for their, the extra knowledge and skill sets that they bring to the organization and in turn to youth and families.
I just want to say, and I'm not sure, Tamisha, if you wanted to say anything, but the panel that I was in just before this, we talked about how this question could just be the entire question for the whole session and how there's just so much to unpack when we're talking about this and the perspectives and privilege. And I really like that, the very distinct advantage that folks have in this space and accessing these systems. And so appreciate that share. And that was resonating and I wanted to share that, but I don't know, Tamisha, if you wanted to add anything to that.
No, that was a great response. It's interesting because Ebony mentioned earlier, it's important to shift the language to what happened to you as opposed to what's wrong with you. And that was my experience as a Black queer youth. The first time I met with a clinician, that was the question. Is what's wrong because of my behaviors at school. So I think when you don't have a certain cultural awareness, you're not culturally responsive, it can do a lot more damage because that caused me to step back from receiving the necessary mental health services that I needed until my adult years. So I think that compounded trauma, and when we think about the historical and the racial trauma, is very imperative that we're mindful of that. And we receive proper training on that as service providers, because if we're going in ill prepared, we can do a lot more damage. So I think Ebony's response was perfect.
Yeah, I love being in space with you both and everything that you were sharing, and just really thinking about that last point that you made about, coming into a space and how we can inadvertently cause harm if we're not prepared and we're just not in the right mindset, or we don't know, or the biases that you talked about before, and how these things can impact the experience that we have when we're engaging with young people and families and just folks in general, and how important that is. And so I just thank you both for your comments on that. I know we have a couple more questions on the next slide, the last two questions, and then there is a question in the chat here. And so I want to give time at the end to talk about some of these questions that are coming up. Let's go to the next slide. And so thinking about the impact that crisis situations can have on staff, what is your structure of support wellness for your team members? If there's anything that you'd like to share on that.
Ebony, you smirked. Is there something you must say here?
Well, I think I'll let Tamisha take this one away. I'm smiling because of how exceptionally grateful I am to work with such amazing colleagues. Some of them even in this Zoom space today. Terrell, Mariah, Callie, I think I saw a few of our Stanford Sierra advocacy team that is on the ground doing amazing work every day. April is here as well, giving so much of themselves to youth and families. And with that, just how grateful I am for my colleagues who create safe spaces and in their relationships with our teams. And so I'll let Tamisha share some of the ways that we do that. But I am proud that it is of utmost importance that we work towards prioritizing staff wellness within our family partnership team and and across the organization, to elevate that. So I'm gonna pass the mic to Tamisha to talk about some of the ways we do that.
Absolutely. As I mentioned earlier, our team members are going out in the moment in the community with youth and families to support in the midst of crisis. So I think in those situations, just being available, sometimes for in the moment processing or problem solving or support. With that, we also, the Family Youth Partnership team within the agency, we actually created a group. Initially, it was called the Vicarious Trauma Support Group. Now it's a Peer Wellness Support Group, just to process the heaviness of supporting with crisis constantly throughout the week and throughout the days, honestly. And that's an intentional space for team members to be able to be vulnerable. I think to establish accountability partners, saying at the end of your workday, how are you going to take care of yourself? What is your ritual for disconnecting from work, especially as we're working from home? Are you going straight, closing your laptop and just turning on the TV, or are you going to go for a walk or to the gym or do something intentionally to really disconnect from the work and put yourself in a different mindset? So there's an intentional program design around that. In consultation, we're also asking those questions, again, from a preventative approach of what do you need? How are you doing this week? Do we need to plan for some time off for you? You've put out a few fires this week. How are you feeling? How are you taking care of yourself this weekend? Can you take off Monday to extend your weekend to really refill your cup before jumping back in to do a lot of this heavy work? So just constant check-ins and making sure that your team members are feeling supported, as Ebony mentioned, their boots on the ground, doing the work with youth and families.
Yeah, and we have, in addition to the wellness support that's every few weeks for our team, we also have a weekly recovery and recharge, which is a sobriety support group as well for our internal staff. We have a walking group that one of our other colleagues on our team facilitates, so you can just join. We're not talking about work. We're just hopping on, shooting the breeze, all walking in our own virtual environments that I've joined, and is a lot of fun. I'm like, hey, where y'all at? I'm just joined the walking group. And so I just appreciate that we have spaces that we say, if we're going to provide unconditional care and regard for our families, we have to demonstrate and model that same unconditional care and regard for our staff and our colleagues, our team members. And so, it is the crisis happens in this year. We've had ridiculous amounts, and I can't express enough just what the level of commitment and persistence and honor and integrity that our team operates with, and I know that we're able to do that better when we feel well cared for, and we're able to stay because we know that there's support systems in place to continue that work.
Yeah, I want to elevate a comment April left in the chat about how you make this work look effortless, even when it's not. And so just, really wanting to echo that in all of our interactions with your team. It's really evident how much you practice that wellness and that support from the inside out. And what a difference that makes.
Mariah, yeah, I'm sorry. And Mariah, and I don't want to put her on the spot, but Mariah acknowledged affinity groups, and I completely, there is a lot, and affinity groups is another one, sometimes called employee resource groups. With Mariah, feel free to share, but we have affinity groups that are available for our staff internally as an opportunity. So Black affinity groups, Latinx affinity group, LGBTQ affinity group, white privilege affinity group, all opportunities to share space and with someone with similar identity. Mariah, I don't know if you want to quickly add to that. I know we're running short on time, but you elevated it. So I'll pass the mic to you as a part of this conversation and dialogue.
Yeah, absolutely. If Mariah wants to hop in, and we have a few minutes. And so I think this kind of dovetails into this last one here about just, any final thoughts and sharing. So yeah, absolutely. If Mariah wants to jump in, and I know we have a couple questions in the chat, but definitely want to hold some space for her.
Yeah, for sure. Mariah's like, I'm quiet. This was y'all thing. It's all good. Which is a good dovetail. Feel free. Oh, she can't unmute. Okay.
Well, we'll see if our tech host can get her unmuted. And I want to share too, your leadership style, Ebony, just the way that you hold space for your team and you elevate their experiences and their involvement in this work. And it really just, there's often a top down, and I feel like every time we work with your team, there's just such a shared love for this work, and I know that the leadership structure at Stanford Sierra really is something I want to elevate in terms of creating such an amazing environment for everybody involved.
Thank you.
I'm going to second that. As someone she directly supervises, Ebony is absolutely a walk beside me type of leader, and it is truly appreciated in this work.
So I don't know if we were able to have Mariah unmute.
I think I just saw her come off mute.
Okay.
Yes. Hello, everybody. I wanted to sort of just elevate the affinity groups because I feel like they've been really supportive in my work. The affinity group, I specifically joined the African American Black affinity group, and being able to just like connect with my people on a different level is truly empowering, and also just being able to feel comfortable about some of the things that we talk about within the workspace, within like the world around us, has been very, I don't want to say like humbling, because I think we all have our own experiences that like are very traumatic, but I think it's just been very supportive. If nothing else, to know that there are people navigating the same concerns as me, even though like I might not work with them all the time, because as a youth advocate, I work mainly with like clinical staff, which oftentimes don't represent like who I am as an individual. So being able to connect with like people that are of the same community really does support me in this work in like the long run. So yeah.
Thank you. And I appreciate you being willing to hop off of mute to share, being called on the spot like that, a little bit of a pop quiz.
I know. I knew she's amazing, and has shared her experiences with affinity groups in other spaces. So but I'm really grateful for you, Mariah, for jumping off and kind of just sharing what that was like for you. Yeah, and Tommy's just saying it in the chat. And I see if we want, we can dovetail into some of those questions that are in the chat. One of them is around affinity groups. So if we want, we can start there if there's time.
Yeah, absolutely. So I think the one that you saw is how does having affinity groups work within your organizations?
Yeah, so that's thank you, Estrella, for asking that. We developed those at the end of last year was when we started putting together an infrastructure for that. We identified folks from various groups within the organization that would be willing to lead and or facilitate the space, because it's really a shared space for all of us in many different identities. And so varying different staff, stepped up like, hey, I have a Native Indigenous background and I'd like to lead that group. I want to lead a group for an Asian Pacific Islander. And so we developed a train the trainer for the facilitators who were leading the space. And then we looked kind of at our calendar of all the different meetings, because we really wanted to make sure that those affinity groups were held at times that didn't conflict with something that they were also required to attend. And then from there, rolled out those monthly. It's completely optional, and just an opportunity to just drop in once a month with folks with shared identity. And the topics range from how we're navigating the space. I can share from the perspective of the Black affinity group, how we're navigating the space and in various spaces in the workforce as a Black person, a Black woman, a Black individual, to last month, the mass shooting in New York that was very directed at our community and how we were navigating that. And a lot of spaces in the work were asking how folks were doing. And I know that for myself, I wanted to talk about it with those that reflected me. I didn't want to share that space with others at the time because it was something that was deeply personal for me. And so I believe that that's the same for many other identities in having that safer space to do so. And that's been helpful for folks as well.
Thank you. So it looks like there's a follow-up to that as well about organizational support and how did you all get leadership support? And so if you wanted to add anything onto that question, I know we have one more question, but this was a follow-up to that.
Yeah. So I'm leadership. Tamisha's leadership, Mariah's leadership, the other folks on here. I think we're all leaders in that sense. Just across the board. And I think, when we're talking about leadership support, I think we do have a very strong leadership that wants to make sure that we're creating inclusive environments for our team members, and we're committed to that. So when we get ideas, thoughts, suggestions, I think we take that into consideration so that we can put things in place that will really support our youth and families and our teams.
And I think discussing the impact and why those groups were necessary was also huge in that process as well. I think we say affinity groups, and a lot of people were like, what is that? So I think truly naming what it is and the impact that it can have across our workforce was huge with getting folks on board with that as well.
So I know we only have about a minute left, but there was one more question, and it's, but for who is uncomfortable, we can talk about disparities in our communities of color all day long. As an Afro-Latina woman, I can do that, but I believe part of the transparency is acknowledging why it's uncomfortable.
Yeah. Yeah, I think you're right on, spot on, Lizette, is that I always share 20 years ago when I entered the workforce, having discussions around race was taboo, right? There was like a few things. They were like, there's these 3 things you don't talk about at work. And race was one of them. And now we know that it is critical to have them, right? That we can't keep doing this work without having these conversations. But there's a lot of folks in the workforce that just haven't gotten there yet. And also that, their own identity, how they've experienced their own family culture and community impacts their ability to have these kind of comfortable conversations. My kids have grown up kind of sitting in the space of having racial dialogue. One, because it was a matter of survival for my family to have that dialogue was critical conversation, but also because of our community and the knowledge that we have, and we want to make sure that they have that awareness. So it's normed, but for many families, it's not. It's often still taboo. So in the workforce, it can be even more uncomfortable. And I think the more that we're naming it and saying it's okay to sit in that discomfort, honor what's coming up for yourself and in your body, and then work through that, if you will, while also taking strong care of self.
Absolutely. Thank you. I just want to say again, thank you so much to Tamisha and Ebony and Mariah for hopping in, and the whole team at Stanford Sierra. You're all doing so much work, so much amazing work, and really making a big difference in the community, and you're active in so many spaces. And so just a huge thank you for taking time to be with us today, and to share about that work with the folks that are here in the room with us. I just appreciate you sharing so much. Your leadership style is so inspiring, Ebony, and the work that you and your whole team are doing to create space for your staff, especially in times like this. I know we say a lot in our sessions how crunchy it is right now, but really not wanting to minimize just how hard it's been, just day after day, with what's happening in our world. And so thank you for your leadership in this space, and for showing up here and everywhere. And so for those of you that joined us today, thank you for the work that you're doing. I know a lot of you are working in community settings and you're on the ground every day as well. So thank you for all the support that you're lending to the families that you're working with